And as you know from yesterday, we had 5 government caucus meetings. 5 regions and the caucuses were talked about, and yesterday afternoon caucuses were looking at what they needed to do to move forward and the issues that were outstanding and so on. So again, we're looking to support the caucus in terms of how they function. And we are, in our discussions with the governance committee at the last one, we were confirming that we are, especially in this area, because of the political nature of that discussion, needing to take direction from the regions on how they want us to support them. We are willing and able to provide, again, similar to the community engagement hubs, some resources available for the caucuses to work and function. We heard loud and clear the first time that we went out with a dialogue on the governance work, how important it was for the regions to run their own process. So we're waiting for that. We're waiting for instructions from the region on how it's going to work and trying to help everyone keep in mind that as you make decisions, we have to, inside the society, make funding decisions that support that. And so we're looking forward to furthering that discussion. And within those 2 processes, I think that we see the opportunity for several coordinators to be working in each of the regions that are there on a proactive basis to work on health governance and most importantly on health actions. And the reason I say most importantly on health actions is because although the governance work is big and it's an important piece of work under the tripartite health plan, I really feel that the health actions is where the rubber hits the road. It's the stuff that's happening in communities today that we have an opportunity to look at a better way of addressing. And that's really what we need to address through the community health plans that Debbie was talking about. And actually through the hub process, we're actually talking about a community wellness plan because we know that a lot of our communities, especially those that are part of transfers, are part of a community health plan that Health Canada has as part of its processes. So although those health plans cover a range of services provided by the federal government, there's a missing element to that, and it's the provincial services and the linkage to that piece. As you know, under the Constitution of Canada, the provincial government has that responsibility to deliver services. And as we talk about at the tripartite table, that responsibility goes to all British Columbians, all First Nations people that are here. And we don't do a good job of planning for that. We have the Aboriginal service plans through the health authorities, but I don't know if that really hits the mark in the kind of detailed discussion that we need to have. Perhaps in some regions it's better than others. Perhaps communities feel they're part of that process or not. What we're trying to generate through the hubs is a community-driven process where communities and nations come together to talk about what health means for them in a holistic perspective, in a wellness perspective, in a perspective that you would prefer to put those information and that kind of planning forward. And to me, that's the expression of health governance at a level where we're hearing directly from communities about what's important and how it should look. So as we move forward with that, and now that everyone is, in the last day, spent a lot of time talking about governance, one of the things that I try and do with my team is to create a balance in that discussion. Because now that the health governance has such political will behind it and it's pushing towards agreements in December and so on, we can't forget about the health actions. And as we've been moving forward with the creation of the society and the transition into this hopefully administration that will serve communities better in the implementation of this plan while we're negotiating the governance work, we recognize we haven't done as much as we wanted to in the area of health actions. And with our tripartite partners and with the focus on the governance work, things have shifted a little bit, but we need to shift them back. Because to me, the governance work is only as good as the health actions are implemented. And because it's not, as it was described, a fully shift of a jurisdictional arrangement, which I think is really difficult in this province because of the many First Nations we have and where everybody sits in relation to their own, the control of their own rights and title and their own self-government, that what we're trying to do here is to create an arrangement where we need to identify a way of working within the areas that the federal and provincial governments are acknowledging that they have responsibility to First Nations people, but they don't do a very good job. So we want to find a way to take those pieces, that federal and provincial space, and basically have it managed and run through a First Nations lens. And the discussion at the governance table is around what those accountabilities would look like, and how do we ensure that we put in a legislative framework that gives that new arrangement some legitimate power and authority. And so it is different than what we're used to at the treaty tables and the other kinds of discussion we have, but it creates a great opportunity for us to have better influence over the monies that the federal and provincial governments are spending in those areas, and it's something we need to figure out how we can best make work for us. So the discussion moving forward for us, as I mentioned, around creating a balance in that dialogue, when we do our work at the Health Council and with the Health Society staff, we're talking about a number of things. We recognize our two priorities, the health actions and the governance work, but we understand before we can make that work, we have to support First Nations communities. And so the community engagement hubs, Gathering Wisdom, a number of other initiatives where we're starting to engage. An important one is going to be discussed tomorrow, the Health Directors Association. And whether or not we have a governance agreement in December, the Health Directors Association is critical so that we have a network that our First Nations health directors can work through in a way that they can efficiently and effectively share and gather information, assert their collective views and authorities over the kinds of work that is taking place underneath the tripartite health plan. And it's unfortunate it's taken 3 years to get to this point, but it's taken a long time to move that forward. So I'm looking forward to the outcomes of those discussions tomorrow and hoping it's going to take great strides, make great strides moving it ahead. The second area that we need to be very careful and cognizant of is the need to support the First Nations political discussion. The First Nations Health Council is providing a leadership role in that regard on behalf of the 3 political organizations. And as is mentioned, moving forward, recognizing that perhaps through the governance discussions, if there is a health council at the end of the day, it'll have a different form. It won't be perhaps appointed by the 3 political organizations, but might be more of a regional representation model. But the people that are sitting on the governance working group and the caucuses and the feeding into the interim health governance committee have that opportunity to shape what that's going to look like after we finish those discussions. And so I think the work is well underway in terms of supporting the political discussions, the reporting to the 3 political assemblies, and the engagement in the regions through the caucuses.